Okay, so just jumping right into it, and I don't know, Stacy, if you could hear me at the very beginning of this, but I was telling Russell Squared over here, a big part of the reason why we want to do this is to make sure that the message is very unified coming from the hospitals, and it's not Midland versus Odessa versus city councils versus whatever versus the CDC. We just want to make sure that our local hospitals, that message is very clear. So that being said, I mean, we are seeing, and my expertise is more so with Midland because that's what that's my beat. That's what I cover more consistently. But I want to know exactly what's happening in Odessa as well. So just jumping right into it. I mean, I know Midland has brought in state help with FEMA nurses. I know ORMC has brought in FEMA nurses. That's a big deal. And we don't bring those nurses in from the state unless we need that help. So what is COVID like right now? And we'll start with you, Russell Tippin.
Yeah, good morning. Our COVID has really taken off this weekend. We come in this morning with 96 COVID-related patients. That's up about 25 over the weekend. And I think you're right. I think one thing that's been pretty solid from the beginning of this is all three of these hospitals working together. Stacy and Russell and I do a lot of behind the scenes work and a lot of behind the scenes communicating between the three of us just to make sure that everybody's okay. We have a medical center. We're no different than anybody else. We've brought in FEMA nurses and respiratory therapists and equipment. And I think just right now in West Texas and especially right here in the Permian Basin, the COVID situation is very dire. I mean, it's very serious, and it's really putting a strain on all three of us. And but I can tell you this, the three people on your screen today get along very well, do a good job of communicating with each other and making sure the other two are covered when they need something. And for that, I'm very grateful for these other two folks on here.
Great. And Mr. Myers, we'll head to you.
Russell's exactly right. We do cooperate nicely. Things are just like at Medical Center. They are the worst they've been to date here in Midland. I don't have this morning's update, but last night's update was 91 inpatients with 8 more holding in the emergency department. So what should have been 99 by sometime late last evening. We never would have thought we could handle 99 COVID patients, frankly. So we've opened a new floor. Most of it, there's 12 of those net new beds that are not open and won't be for a couple more days. We've had a substantial number of nurses provided by FEMA, which is huge. We don't dictate to them what they give us. We ask, and we happily accept whatever comes. We have ventilators here that have been provided by the state. So just like Medical Center, very high levels of disease here. Also among our staff, those extra nurses and respiratory therapists are particularly crucial, not only because we're caring for so many more patients, but because our staff are going down. We have lots of exposure in the community. I don't have today's count, but we've been north of 100 who were either out quarantined because they were positive or showing symptoms, or at least had been exposed and were being monitored and still allowed to work. So our staff live in the community. They get exposed like other people do, and it devastates our ability to care for people. So we're really blessed that all these folks from all over the country, frankly, who are agency traveling nurses. This is not a bench that's sitting in Washington waiting to be dispatched by FEMA. They go gather them up from agency resources and contract with them and send them here if they can find them. And we're blessed that they've been able to so far.
And Stacy?
Yes, thank you. It's very much the same at Odessa Regional. Currently, we have 26 in-house with 2 holding in the emergency department. So while our numbers are less than the other 2 hospitals, we're also a bit smaller than they are. This is still the highest that we've seen as well. 11 of those are on ventilators, and that too is an alarming number for us. Everything else that Russell and Russell have said is the same. We have the FEMA nurses here, about 36 FEMA nurses, about 6 of their respiratory therapists. And again, we wouldn't be able to take care of these. Even we are incredibly grateful for that. We are working to add more surge capacity, both at Odessa Regional, and I'm also over Scenic Mountain. Those numbers are very much the same. We've got close to 20 patients there as well, working on additional surge capacity beds, have FEMA staffing there. And as Russell Myers said, the bigger concern now is, I mean, it's concerning with the numbers where they are, period, but the fact that we also have staff out. We've not seen this level of staff that are out due to either quarantine or isolation due to high-risk exposures as what we do now. Those numbers are upwards of 40 for Odessa Regional and 15 to 20 or so for the Big Spring community. So it's a very concerning situation for all of our hospitals.
Yeah, no kidding. Mr. Myers, I just want to confirm, over the weekend, it was around 100 FEMA nurses.
Yeah, well, last week we were over 100 total staff that have been provided, and
Okay.
at least 9 of those are respiratory therapists. The vast majority are nurses, split between critical care and medical surgical training.
Okay, and then Mr. Tippin, how many FEMA nurses and respiratory therapists have been brought in at Medical Center?
We have about 40 here today.
40. And of those, how many are respiratory therapists, or are they just strictly nurses?
Yeah, the respiratory therapists are 7.
7. Okay. Okay, perfect. So the big thing that I want to move on to, now we've got the numbers of what the state is providing, but a big conversation out here in West Texas is behavior. And what if behavior out here, if nothing changes behavior-wise, what is our region, what are our hospitals going to look like in a matter of a few weeks?
Well, I'll start. We run a testing center here, and we're trying to expand our hours and our capacity, but we're routinely testing over 100 patients a day. And for now, I believe we're 9 weeks in a row when the percentage of those that come back positive has grown. Last 2 weeks, it's been north of 30% of those patients we're testing who come back positive. Now that's only a snapshot of what we test. There's lots of other people testing, and we don't have good access to their numbers, but assuming that's a reasonable indicator, that means there's more disease in the community than there's ever been. And when I've talked to our doctors, it's a week to 10, 12, 15 days incubation period from that first minimal symptoms to needing to come into the hospital. 15% or so of the people in the community who are positive will end up in the hospital. So, if we had all those positive tests last week, those people are going to be in the hospital next week, or 15% of them are. Thanksgiving is coming. We've got, I think everybody, everything that I've read, what most people believe is that the biggest spreading events are family gatherings. People believe for whatever reason that they can't transmit it among family members, and that's exactly what is happening. Thanksgiving is one of the worst holidays of the year for family gatherings, and so unless people are very serious about minimizing those, wearing masks where they can, holding them outside if they can, all of those things all work, but only if we do them. And if we don't change behavior, we're all at or near our capacity now. I'm amazed that our team has put together enough capacity to serve 100 or more COVID patients, but we can't serve 150, and something's got to change, or we'll max out. We'll freeze up, and we'll have to start turning people away. Where they will go is not clear. There's not many places for them to go anywhere near here.
We feel the same way. Our issue is just when we think we're at capacity, our staff pulls a rabbit out of a hat and finds more beds and a new way to staff and a new way to do things. And I think what you got to be careful of here is when you start talking about the gatherings that people have to be very careful. Mr. Myers is correct. Thanksgiving, we all want to get together. We want to eat. We want to spend time together. We want to watch the Cowboys together, whatever that is. Last week, we did our first full week of our testing with the agreement we got in with the city of Odessa. We did over 1,700 tests last week. Then we had a mobile testing this weekend at Ratliff Stadium where we did over 200. So we tested over 2,000 last week, and that's coming right back about 35% positivity rate out of those tests. And so that number continues to climb. And I know people continue to travel or are going to travel over the holidays, and they just need to be very careful with that and make sure that you're doing your part to stop that and not making your family sick. And it's just going to be very critical that we're safe, especially over these next couple weeks.
Yeah. And Stacy?
Stacy looks frozen.
Yeah, I think so.
Stacy looks frozen. Okay, we'll give her just a little bit here. You know, Zoom, sometimes it just gets really.
Wait, we're going to get to the. I was frozen. Is it working now?
Better now.
Still frozen on the screen, but we can at least hear you.
Yeah.
That's better.
Okay. Well, yes, what I wanted to say is the biggest concern I think we all have is that we're going to get to a point where we will not be able to take care of our community. And I don't think any of us, including our staff and our physicians, can think of anything more heartbreaking for a healthcare facility to be in that position. If you remember back to late June, early July, when we were seeing the previous surge, we went into a mask mandate at that point, and our numbers came down. We can do some very simple things to get a hold of this, and the most important of those is wearing our mask and distancing. So we can still be around our family for Thanksgiving if that's what's important and we feel that we need to do that. But unless we're all in the same household, we need to be wearing a mask while we're around each other. And we need to spread out a little bit further when we have our Thanksgiving dinner. The mask, the social distancing, and washing of our hands are such simple things that we can do that will save lives in our community. And we urge everyone to please do that.
So speaking of masks, they're a hot topic right now. Very hot topic. They became a really big hot topic in Midland last week. So much so that our mayor has moved to put it on the city council's agenda tomorrow. Is that something that you hope the local government enforce? If so, why?
Yeah, since it's Midland, I'll talk about that. Yes, the short answer is yes. I think that, it's been a struggle. People in West Texas, as much as anywhere in the world, value their freedoms. Sometimes I believe that we have people who, just because you tell them that they should do something, that's a good reason not to do it. and unfortunately, that's affecting our numbers. What's on the council's agenda tomorrow, and I'll be there to speak to them in support of it, is a mandate for businesses. It's not an individual mandate, which I think the mayor has accurately described as essentially unenforceable. But if we talk to businesses and we require them to require their customers to wear masks to enter, I think we have a chance of actually achieving something that is enforceable and that people will actually do. I don't have a better idea than that. I think it's a very good idea. I'll strongly support it. I hope that people that see this interview will let your council people know that you support it. It's very difficult for them because they hear those loud, angry voices that say, I'll die before I wear a mask. Well, yeah, you might. And if they hear from the majority of us who have good sense and are told that we support a mask ordinance and a mandate, then they may act on that. And I hope that they will.
Yeah.
I think you'll hear something come out of the governor's office this week too. I'm thinking that with what's happening in El Paso and Lubbock and Amarillo and now in West Texas, I think we'll hear from the governor's office this week. I think he has a press conference on Tuesday as well. So we'll be on standby for that. But the masks work, folks. I mean, it's pretty simple. They work.
Is this something that you would like to see Odessa City Council address?
Well, I think the safer you can be, the better off you are. And the funny thing is, and Stacy was exactly right. When we were in the mask mandate earlier, there is no doubt the number decreased, and we weren't in those masks very long. And if we went a week or maybe 2 weeks in a mask, I think you'd see a huge decline. I mean, look at the flu season. We're right smack dab in the middle of flu season. Our flu season's almost non-existent here. Yep. And I think that is directly related to people were wearing masks when flu season first started, and that has kept that number down.
Yeah.
Good point. That's true in Midland as well.
Yeah, I saw like total, there's been like 89 in Midland. The average is like around 150 this time of year. So that is a pretty significant decrease. Stacy looks like she might be frozen again. Stacy, I don't know if you're on your house Wi-Fi or office Wi-Fi, but sometimes if you try your phone's cellular service, it works a little better. Looks like she's trying it out. So after Stacy answers this question, I do want to touch on that because the naysayers in the world out here are very loud, and they do say, well, are those COVID numbers flu numbers? Are they combined? And I want to touch on that they aren't. Oh, Stacy, that's already so much better. Oh, so
I was not on the house Wi-Fi, so that helped.
Okay, perfect. Yes, this is so much better. I should have asked you to do that a question ago. Okay, so we're just talking about masks and whether or not you're for Odessa City Council starting to enforce a mask mandate.
I'm for whatever we can do that will save lives in our community and lessen this disease burden on the healthcare facilities. It's not sustainable. You have to think about the lives of the people who are taking care of the sick as well. They're exhausted. They're burning the candle at both ends. I mean, it's just not sustainable. So if we can't do it on our own, then I'm for whatever we can do to help save lives in our community. I just think that it's incumbent upon us as leaders to at least do better. And I think we can definitely do better.
Yeah. I think it's important that people understand that information about this disease is coming directly from medical expertise, not elected officials. It's coming from our doctors and physicians in this community who are very familiar with this virus. And the people who are familiar with this virus have a very consistent message, it seems. We need to enforce masks. We need to have everyone wear a mask so that we see these numbers drop, so we see hospitalization rates drop. Is that the general consensus here?
No, there's no question. Yeah. And that's the word from
Yes.
the CDC. I hope people saw, it's amazing how much information is out there. The CDC just last week not only said clearly that masks protect others, but that they now have strong evidence that they protect the wearer as well, which was not the case early on in this process. So I'm hard pressed to figure out why this is so difficult. The mask is not, it's not a burden. Being in the hospital, certainly being ventilated, those are burdens. Having your family have to deal with your illness and not be able to visit you in the hospital because we can't allow visitors. Those are burdens. A mask is nothing. Wear a mask.
I compare it to almost wearing sunscreen when you go outside. If you're outside for a long period of time, you put on sunscreen. Why? Because you don't want to get burned. And that's inconvenient sometimes too, but it works, right? I mean, just like the mask, you put the mask on for a short period of time, it saves a lot of heartache after.
And Russell, you said this before too. It's no different than a seatbelt. We wear a seatbelt because it saves lives if you're in an automobile crash. So why is the mask so difficult?
Yeah. Great answers all around. We've touched on in terms of holidays. So since we are getting closer to capacity, at what point do you hit the alarm for the state to come in and help? We're seeing that happen in El Paso with a mobile morgue, FEMA nurses. It seems like we're inching closer and closer to getting to that point. How close are you, and why are you two hitting that alarm button? Stacy, why don't we start with you? We haven't started with you yet.
I think we're closer than we realize, quite frankly, and I don't know that we'll know exactly when we're there until we're there. It'll be a matter of us having patients that are in our emergency rooms that need to be admitted, and we don't have capacity in our hospital. Medical Center doesn't have capacity in their hospital, and neither does Midland Memorial. And so we really won't know until we get there, when we're in that gridlock situation. And what a horrible place to be. I think it's just important to know that we are doing everything we can. I know all hospitals are still working on additional surge capacities. We are as well. We're continuing to try to find more spaces, more equipment, more staff to try to take care of our community. Already we have probably a third, if not more, of the patients that are in our hospital today from out of Ector County. And so it's not just our community that we're taking care of. We're taking care of whoever needs it if we have the capacity at that point in time to take care of them. And so I think we're closer than we want to be, for sure. We need to go the other direction and lessen this burden instead of continuing to test the boundaries to see how far we can go.
Stacey, I heard, sorry, I just want to jump in here. I heard that ORMC has ordered a mobile morgue. Is that a rumor, or can you speak to that at all?
I think we're working with the city command center for a community mobile morgue. And that's because you have to understand, it's not only are the hospitals getting overwhelmed, but with the deaths of this disease, so are the funeral homes. So when we do have a death in the hospital, it's taking us longer and longer to take care of that patient and get them where they need to be next. That's another bed that we're waiting on to be able to take care of one more patient. So it's a matter of being able to expedite every step along the way what we need to take care of the patients in our community.
Wow. Yeah.
I think Stacy touched on two things that are very important. One, it's not just the 3 people on your screen that are being maxed out. Even our partners in the region, you're starting to see hospitals that carry 1 or 2 patients a day that now have 13 or 14 patients a day. So they're stressed. They don't have anywhere to send them because we're full. And I think the biggest thing to realize is it's only going to take one of the 3 of us on this screen to push the panic button, and the other 2 are automatically going to have to push it as well. Because if one of us is maxed out, then the overflow is going to max everybody else out. So it's only going to take one. And so if one gets in that situation, the other 2 will definitely be right there with them. So I think that's important too.
Sammy, I think the question was about at what point do we press the panic button and call the state for help? We're calling the state for help every day, and it comes in different forms. I think the idea that the state can stand up a field hospital and that it solves our problems, I think that's a little overstated, honestly. They still have to staff those beds. It's a substandard environment to be cared for in a tent that's basically a massive, sort of a military style ward. What we're doing here, as I know the other 2 are doing, is finding every resource inside of our buildings, which is going to be superior to anything the state can stand up. You think about, a mobile hospital, no matter where they put it, it doesn't have a CT scanner in it. It doesn't have a lab. They're going to be dependent still on our ability to support that mobile hospital. If we can repurpose parts of our old building that are substandard but still workable, if we can close a recovery room and turn it into a critical care ward, I mean, those are better options than a field hospital, but it takes people and equipment to do even those things. We're talking about that stuff every day. Can we do tomorrow's surgeries, or do we need the recovery room for critical care patients? Should we shut down the endoscopy lab and steal its monitoring equipment? We're really at that point every day where it's like a big scavenger hunt here. Where's the next monitoring device coming from, or where's the next suction regulator? Or we're using everything we can find. And while the supply chain has recovered on the personal protective equipment side, I think we're all in pretty good shape there. The patient care equipment side of the supply chain is still broken. We can't easily get the next ventilator, the next monitoring device, the next regulator or oxygen circuit. Those things are not easy to get. It's slow moving. So, you know, it's difficult all around. But bottom line is we're asking the state for help every day. For the most part, they're coming through.
I mean, could you have imagined in March when we were, you know, getting word that this was a thing and we were really seeing it impact New York City, or even, you know, February, we were hearing about coronavirus. Could you imagine that we would be here today, almost a year later, battling this virus like we are?
Well, yeah, we imagined it. I can tell you that you know, one of the great gifts that we've been given by the foundations in our community has been the build out of our 9th floor. And that process started back in March, April timeframe when this thing looked like it was a crisis that would build and have no logical endpoint. We knew, and the foundations knew when we talked to them, that we couldn't get that construction done before the fall. And they said, here's the money, go do it, because we don't think this is going to be gone by the fall. And sure enough, I mean, that's not a prediction I would have been, that I'm happy is true, but it certainly was envisioned at the time. This is a worst case scenario. We had hoped that it wouldn't be here, but certainly could imagine it. And here we are.
Yeah. That was a great answer. I just wanted to get a little context on things, but I'll move on to another question. Another big thing that you see on social media that we just want to debunk, well, the hospitals are having financial gain from this virus. All of you have the same reaction there.
We can debunk that if you'd like.
Yes, let's debunk that.
Well, I can tell you, just for us, we got about $17 million in CARES Act funding. And that was about equal to the lost revenue, the difference between last year's revenue and this year's for, I think, through June. And so as the rest of the year went on, we continued to see losses. Just in this past month of October, we've just reported October numbers. We lost almost $1 million just in October. And the hospital's full. You know, we're packed. We're not doing, we've lost some elective volume because people are staying away, but we couldn't have any more inpatient volume. COVID is not a profitable business. People that think that it is are just, you know, they're just repeating a line that they heard somewhere. There's a Medicare add-on for an inpatient COVID patient that's 20%, and that's very helpful, but it doesn't make that patient profitable. It makes us lose less money on that patient. We've looked at COVID patients across the board several times during the course of the pandemic, and every time it's clear these are net losers right down the line. And they're also crowding out the business that does make a little money to help support the work that we do. So it's a double hit, and there's no way this is a profitable business. And even if it was, we'd want it to go away and find another way to make money.
Yeah, we experienced.
I'll add. Go ahead, Russell. I'll add to that. I was just going to say that the other thing that people just aren't even considering, and it's because they're not in the hospital business, is the fact of the cost of the care that we're providing. When you talk about these agency nurses that we've been bringing in, we're paying premiums 2 to 3 times what we would normally pay for that staff. The equipment is so expensive. The acuity and the intensity of care that these patients require is incredible. And keep in mind, the average length of stay for one of these patients is anywhere from 2 to 3 weeks. And so it's incredibly intense. You don't make money on patients such as this. Not to mention the fact that our ER volume is down about 40%, our elective surgeries. The procedures where we do make money that help us keep our doors open and cover the overhead and the other cost are the procedures that we're losing because of COVID. And so it's just ridiculous to say that we want this to continue because we make money on COVID patients.
Yeah. Yeah.
I couldn't agree more with my 2 colleagues here. I mean, it's pretty simple math that it's not a moneymaker. There's not a magic $14,000 bonus for every COVID death. When we closed our elective surgeries, we lost $50 million in that, and we received about $20 million worth of CARES Act money, and that works out to be about 15 days worth of cash here in this hospital. So it's definitely more than upside down. It's completely upside down and backwards to think that there's any money in COVID.
Yeah, yeah. It is just so hard and we deal with this all the time in news, when misinformation floods us constantly. And you can't reach across the phone and be like, no, read this source. As much as, once we do figure that out, though, that'll be great. So vaccines, in terms of prepping for vaccines, the big talk today, another vaccine came out that looks like close to 95% of participants were successful. Where are we at in that process? We can start with you.
We're not in control of it.
Okay, we'll start with you.
The short answer is we're not in control of it. The companies are doing great work. The federal government has provided a massive amount of funding to make that go faster than it's ever gone in history in terms of development of a vaccine for a new disease. Both Moderna, which is the one you just saw yesterday, and Pfizer, which announced its 90+% success rate a few days before, those are very promising. We are preparing to be a site, if not the main site, for distribution of the medication. We are anticipating that it will be made available to healthcare workers first, because they are so critical to keeping the rest of the community alive. But there's challenges with these vaccines. The Pfizer one requires ultra-low temperature storage. We went ahead and bought an ultra-low temperature freezer to add capacity in our pharmacy to make sure we can take it when it comes. We're going to have to stand up a large team of people to deliver the vaccine when the time is right, and we think we can do that. But we're right now just waiting to see when it comes. I'm hoping that it's in decent quantity before the end of the year, but we won't be sure about that till it happens.
Yeah,
That's a good point. We turned in our numbers Friday about how many doses we would need and what that would look like. And remember this too, the flu vaccine is only 30 or 40% effective, and look how well that does in the world at 30 or 40%. So you get something that's in the high 90s or even 90%, then that should really help flatten this out. And it's going to be interesting to roll that out. I mean, Mr. Myers is correct. It's going to be I think it's going to be a movie type scene where you have people lined up for a long time to get this and knock this out. But again, I'm encouraged by 90%, 95%. I mean, I took the flu vaccine this year, and I know it's only 30%, but that's still 30% more in my favor. So I think anything we can get will help this situation.
right.
Yeah, I agree with both. There's really not anything else for me to add. I think we're just all eagerly awaiting being able to start. We're all going to be participants in the distribution of the vaccine and are anxious to move in that direction.
And let me say this too, there won't be any money in giving the vaccine either. We won't make any money off of that either.
Yeah, no kidding. Okay, so I know you guys want to move on, and this interview has taken a little bit longer than initially expected. But the treatments that you guys offer to your patients when it's COVID-19, this is not so much a soundbite. I just want to get the logistics of it. Remdesivir, I imagine. What are the other ones? Are they all the same at each hospital, I guess is my question.
Well, our doctors talk to each other for sure, and some of them shared, like in critical care. Remdesivir is still indicated, but for a narrower population than originally hoped. As I understand it, the fundamental support that we offer to people is oxygen. The reason that they come into the hospital in the first place is because they get short of breath, so much so they can't manage it any longer. So a wide range of oxygen support is probably the single most important and most universal treatment that all these patients are getting. There's also dexamethasone, the systemic steroid that's given once we are oxygen dependent. that helps their lungs recover. And as of now, that's about it. The Lilly antibody treatment is coming in very small quantities. It's indicated, as we understand it, for patients who are newly diagnosed and not yet sick. And that's still, I mean, it's an emergency use authorization by the FDA, so it's still a little bit experimental. We heard last week we're getting 107 doses, and our doctors are still trying to figure out, you know, who's the right patients to give that to and when. But that's the range of treatment that I'm aware of.
So is that antibody thing what you get after donating convalescent plasma? Is that, or is that a different?
No, it's a laboratory created antibody boost that Eli Lilly company has just got authorization for. You may remember when the president was in the hospital, he got something. It's not the Lilly product, it's the Regeneron product, but it's the same thing. It's an antibody boost that's infused and has promise for helping people avoid the development of severe disease. But you know, the jury is still out. Our doctors are pretty skeptical about it from what I've heard so far, but it'll get here shortly, and I'm sure we'll try it.
And I think that's one thing that's hampering our partners in the region too, is a lot of these smaller hospitals aren't designed with high flow oxygen like we have at R3, and they can't supply the level of oxygen needs for their patients. And that's why we see a lot of those. I know a lot of our regional folks are really struggling right now with oxygen and just getting that to their patients. And so Mr. Meyer is absolutely correct that all those treatments we're all trying the same thing. Our guys talk, I know, several times a day between the three facilities, but ultimately you got to have air, and the airflow and getting that to the patient is the big one.
Yeah. Yeah. And you don't think about that. That's not in the conversation. It's those big drugs, but something as simple as oxygen.
It's the single most important thing we have. It's fascinating to watch the oxygen. We're using more oxygen than we've ever used.
Like how much?
The tank, well, I don't have a quantity, but we're constantly replenishing, and the tanks are right outside the door when I walk outside my office, and they're freezing over. We're using so much oxygen that the manifold is freezing. We've had to rig up a sprinkler system to keep the outside of the oxygen tank warm so it doesn't freeze up and shut off the flow. Our guys have been really creative, but that's a problem we've never had before. But we're using so much that it's super cooling the equipment and freezing over.
Wow.
And there's not a modifier for using more oxygen than you've ever used to get paid either. That's not in there.
Yeah. Stacey, anything else that you'd like to add that OR is doing differently?
No, ma'am. It's the same. I think Mr. Myers did a great job of explaining those treatment options. So as he said, our facilities, our providers particularly communicate on the treatment care plans quite frequently. So
yeah, I mean, it sounds like the communication, we'll wrap it up here, but that communication between all three of you is very important, almost crucial, because it's all hands on deck right now. That's what it seems like. And how important, how helpful has that been to communicate where you're at with one another constantly?
Well, I think it's definitely in the best interest of our community. We're all here for the same objective, which is to take care of our communities. And so the more we collaborate and share information, learn from each other, organize together, the better off our community is. And so I know each of us are very proud of the way that our facilities have worked together at all levels. The CEOs, the intensivists that are providing the care, our nursing leadership, all the way down. It's impressive, and it, quite frankly, is the way that it should be. So we're thrilled to be a part of it.
I think between the three of us, we always have at least one good idea. So I think that putting our heads together and coming up and knowing that we've got each other's back, I think it's just shows you that in West Texas, we can put everything else aside and work with each other to take care of the patient. That's pretty cool.
Yeah, no kidding.
I completely agree.
Yeah. Okay, well, you guys have been so helpful, just giving us so much more information. We should have done this sooner. I'm sorry under our circumstances that we needed to do it today. I'm going to give you guys my phone number. If there's ever anything that's happening at the hospital that, you know, I've kind of become a hospital reporter on accident here. But if there's ever anything that you guys want covered or want to update me on, please just let me know. It's 720-448-6311. I'm from Denver, so that's that 720 area code.
Thanks, I was about to ask.
Yeah, exactly. Yep. So yeah, if there's ever any,
Explains everything.
yeah, right. If there's ever just, you know, anything that you guys want, or, you know, maybe there's a really amazing story that, you know, the patient would be comfortable going on camera about it, or a staff member who has a really powerful story, maybe something that's happy and not even COVID related, please just let me know. And those finances part are an important thing because people are going to be curious about it. So if there's ever a meeting that I should sit on, or just let me know. Okay, well, that is pretty much everything that I have. Anything else that you guys would like to add that I didn't touch on before we wrap it up here?
I don't think so, Sammy. Thank you.
Nope.
Yeah,
Safe and wear a mask.
Wear a mask. Well, I will be at that city council meeting tomorrow, and then I'm going to be reaching out to Odessa City Council to see if they are doing the same thing, because there's a lot of eyes on Midland right now, but Odessa seems to just be skirting the question, and you know, the stepchild in Midland, it has all the attention right now. So
Do you anticipate this story running before tomorrow?
yes, yeah. So that's why I wanted to do it today.
Right.
It's going to air tonight at 6. That'll be the big story, and then it will be on our website as well. And then there'll be shorter versions of it in our 10 o'clock newscast and 5 o'clock newscast. And then I'll also post it on my Facebook page, which that just plays the exact video, not a link or anything. So those tend to do better in shares. So if you guys want to share that or something, and I can send it to your PIOs as well.
That'd be great.
Okay.
Very good.
Well, thank you guys so much for making time to do this. I really appreciate it. Hang in there. Know that we're all praying for you. And, you know, I've talked with a few nurses and doctors about what they're walking through, but you guys have the weight of the hospital and the community on your shoulders, not just that patient at hand. So just know, we know that, we recognize that, we appreciate you. And we're just praying that it gets easier for you all and you blossom as leaders amidst these really difficult circumstances.
Thank you so much, Sammy.
Guys.
Okay, well, thank you. Have a good one. Bye.
Bye-bye.